A silver liquid painted onto a child's cavity in a few seconds just stopped the decay in more than half of treated baby teeth. No drill, no needle, no sedation. That is the headline result of a Phase 3 clinical trial of 830 children under age 6, published July 29, 2026, in the journal JAMA Pediatrics. The treatment, called silver Diamine fluoride, has actually been used off-label in dentistry for years, but it has lacked the kind of large, government-grade clinical trial the United States requires before a treatment can move toward formal drug approval. This is that trial. Researchers recruited children through dental offices, pediatric medical practices, and Head Start programs across Michigan, New York, and Iowa, then tracked what happened to their cavities over repeated treatments. Before you assume this replaces every dental drill for every child, let us look at what the trial actually tested, and what it did not. The trial applied a 38% silver diamine fluoride solution to decayed baby teeth, using a tiny sponge-tipped applicator, a treatment that takes only a few seconds per tooth and requires no numbing, no drilling, and no sedation, which matters enormously for children too young or too anxious to sit through conventional dental work. Children were treated at 6-month intervals and followed over time to see whether their cavities stopped progressing, a result dentists call arrest, rather than continuing to worsen toward pain, infection, or eventual extraction. The trial found the treatment arrested decay in more than half of the affected teeth. Lead investigator Margarita Fontana, a professor of dentistry at the University of Michigan, described it as a very effective and safe treatment, safe enough to use in children as young as 1 year old. The scale, 830 children across 3 states and multiple community settings, is what makes this trial different from smaller studies that came before it. Cavities form when acid-producing bacteria break down tooth structure faster than the tooth can repair itself. Silver diamine fluoride works through 2 separate mechanisms at once. The silver component has antimicrobial properties that kill off the bacteria driving the decay, while the fluoride component helps re-harden the remaining tooth structure, making it more resistant to future acid attack. Together, that combination can halt a cavity's progression without physically removing the decayed material, the way a drill does. This matters most for exactly the population this trial focused on: very young children, kids with dental anxiety, and kids without easy access to a full sedation-capable dental practice. Since conventional cavity treatment in a squirming toddler often requires either physical restraint or actual sedation, both of which carry their own costs and risks, a treatment that takes seconds and needs no cooperation beyond holding still for a moment changes what is practically possible in a school nurse's office or a community health van, not just in a dentist's chair. Untreated childhood cavities are not a minor issue. They are one of the most common chronic diseases in children worldwide, and they disproportionately affect kids without reliable access to dental care, whether because of cost, insurance gaps, or simply distance from a pediatric dentist equipped for sedation. A treatment this fast and this simple can be delivered in settings a drill and sedation never could. School-based health programs, Head Start centers, pediatric medical visits that were not originally dental appointments at all. That is part of why this specific trial recruited through Head Start and early Head Start programs, rather than only dental offices, testing whether the treatment holds up in the exact lower access settings where it could matter most if the FDA does move forward on approval using this trial's data. It would give silver diamine fluoride formal backing it has never had in the United States. potentially accelerating its adoption in exactly the community and school-based settings that reach kids who see a dentist least often. Here is the real limitation. And it is a visible one. More than half of treated teeth means close to half did not fully arrest. This is not a universal fix. And the treatment carries a well-documented cosmetic trade-off. It stains treated decay black. A discoloration that sets in within about 2 minutes of application and does not reverse. That staining is far more acceptable to parents on back teeth than on front teeth, where the aesthetic zone makes a visible black spot a real concern. And attempts to reduce the staining with additives like potassium iodide have only partially worked. This trial also only covers baby teeth, not permanent adult teeth. So it says nothing about treating cavities once a child's adult teeth come in. And despite years of real-world use, silver diamine fluoride still does not have full FDA approval as a cavity treatment in the United States. This trial is a step toward that. Not confirmation it has already happened. It also treats existing decay. It does not replace brushing, diet, or prevention. Quick recap. A phase 3 trial of 830 children found that a few-second application of silver diamine fluoride, with no drilling, needles, or sedation, arrested decay in more than half of treated baby teeth. And the results could support the treatment's first full FDA approval as a cavity drug. So, signal or noise? Leaning signal. This is a large, well-designed trial testing a treatment already used safely for years, in exactly the community settings where access to dental care is worst. And the safety profile down to age 1 is genuinely reassuring. The honest catch is real too though. Close to half of teeth did not fully arrest. And the visible black staining is a trade-off real families have to weigh. Not a footnote. This is a strong new tool. Not a universal replacement for the drill. Subscribe for the health research that tells you what actually changed. And what still has not. Signal from the noise. Every week.